Welcome to an Introduction to Immunotherapy, a presentation for patients and families. In this presentation, we will review what immunotherapy is, side effects of immunotherapy treatment, how to manage these side effects, which symptoms to report to your cancer care team, and how to report them. Firstly, we will review what cancer is. Cancer is a disease that starts in the cells of our body. Normally, our body's cells grow in an orderly fashion. However, cancer cells do not behave like normal cells, but rather grow to form lumps or tumors, which can spread to other parts of the body. Cancer is named after the part of the body where it started, for example, breast or prostate. Now we will discuss the immune system and its role in our bodies. The immune system is our body's defense system against disease or foreign invaders, such as bacteria, viruses, and abnormal cells. The immune system is like an army which has many different kinds of soldiers that protect our body from invaders. T cells are one kind of soldier that work to protect our body from invaders. It is known that the immune system can recognize and kill cancer cells. The problem is that cancer cells are sometimes hard for our body to detect, and the cancer cells can slip through our defenses. Alternatively, cancer cells are able to stop the immune system from working properly. Think about it as cancer cells pulling a cape over themselves so the immune system cannot recognize them and attack. Immunotherapy is a cancer treatment that boosts the body's immune system to fight cancer. It enables the immune system to recognize and fight cancer. Immunotherapy stops or slows the growth of cancer cells and stops the cancer from spreading to other parts of the body. Both chemotherapy and immunotherapy eliminate cancer cells, but while chemotherapy targets tumors, immunotherapy targets the immune system and empowers the body to destroy tumors.
One of the most exciting approaches to cancer immunotherapy involves releasing the natural brakes that keep the immune system in check. This approach, called checkpoint blockade, takes advantage of the fact that the immune system already knows how to fight cancer. It just needs a little help. The immune system's main cancer fighters are called T cells. T cells have receptors on their surface that do different things. Some act like a gas pedal on a car, telling the T cell to go. Others act like a brake, telling the cell to stop. Drugs called checkpoint inhibitors release the brakes, allowing the immune system to step on the gas and fight the cancer. Many cancers have learned to hijack these same immune brakes to avoid destruction. They make a molecule that engages the brakes. Checkpoint inhibitors block this interaction as well, robbing cancer of an important defense. Several checkpoint inhibitors are currently FDA approved for the treatment of melanoma and lung cancer. The drug Yervoy blocks a checkpoint called CTLA-4. Two other drugs, Opdivo and Keytruda, block a checkpoint called PD-1. Many cancers respond to checkpoint inhibitors, and the future looks very bright for this important class of immunotherapies. Created by the Cancer Research Institute, the leader in immunotherapy. To learn more about immunotherapy and about clinical trials, visit our community for patients and caregivers at theanswertocancer.org.
Immunotherapy treatment may cause side effects. Side effects can happen from an overactive immune system and can include things like skin rashes or diarrhea. While most side effects are mild, some can be serious or life-threatening. Side effects may happen anytime during treatment and even after treatment has ended. Immunotherapy can act on the tumor after treatment ends because the immune system can remember what cancer looks like and provide long-term protection. It is very important to advise your cancer care team of any side effects you may be experiencing. Immunotherapy treatment can cause the immune system to not only attack cancer cells, but also normal healthy cells and organs in our body. This can lead to serious side effects causing organ inflammation or itis, such as colitis, which is an inflammation of the bowels, or pneumonitis, which is an inflammation of the lungs. Early identification and treatment of these side effects is very important to keep them from getting worse. Immunotherapy may eliminate tumors quickly, but because it works through the immune system, tumors can sometimes take months to disappear. Tumors may even appear to grow larger before shrinking again. Management of immunotherapy side effects differs from the management of side effects for patients on chemotherapy. Patients on immunotherapy should avoid self-management of side effects. Immunotherapy patients may require treatment with steroid medication to slow the immune system from working until the side effects have resolved. One very common side effect of immunotherapy is colitis. Colitis is an inflammation of the large intestine or bowels. Symptoms of colitis may include diarrhea involving 3 or more loose or watery stools, or more bowel movements per day than usual. Other symptoms of colitis include blood or mucus in the stool, indicated by dark, tarry, or sticky stool, and stomach pain or tenderness. If you experience any of these symptoms, advise your cancer care team immediately. Follow these guidelines for the management of diarrhea. Do not take any anti-diarrhea medications or steroids until you have talked to your cancer care team. If you have 3 or more stools above your normal amount in 24 hours, contact your cancer care team immediately. Careful attention to early changes in your bowel pattern can prevent serious harm. If you have 5 or more stools over your normal amount in 24 hours, or if you have any blood in your stool, go to the closest emergency department in addition to contacting your cancer care team. Drink at least 6 to 8 cups of liquids each day. Diarrhea can cause dehydration. Drinking will not stop your diarrhea, but it will help make up for the liquids you lose. Avoid spicy, greasy, and high-fiber foods or drinks with artificial sweetener, coffee, and alcohol, as they may worsen your diarrhea. Skin changes is a common side effect of immunotherapy. Symptoms may include a rash that can be pink to red in color, as well as itchy and dry skin. If you develop a new rash, have no improvement of an ongoing rash, or if the ongoing rash becomes severe, advise your cancer care team. Strategies to manage skin side effects of immunotherapy include preventing and treating dry skin by applying moisturizers. It is also important to protect your skin from the cold and sun. Use sunscreen with UVA and UVB protection and 30 SPF. Another common side effect of immunotherapy treatment involves hormone glands, such as the thyroid, adrenal, and pituitary glands. These glands can become over or underactive by treatment. Symptoms to watch for include headaches, unusual tiredness or sleepiness, weight gain, changes in behavior such as less sex drive, being irritable or forgetful, dizziness, or fainting. If you experience any of these symptoms, advise your cancer care team. Cancer-related fatigue is a common but usually mild side effect of immunotherapy treatment. It is different than fatigue you felt before you had cancer. It is a feeling of tiredness that can last a long time and does not go away with rest or sleep. It can affect your emotions, relationships, and other parts of your life. It can make carrying out regular daily activities very hard. It is often overlooked, but is real and can be managed. Research shows that exercise is the best way to improve your energy and make your fatigue better. Aim to get 30 minutes of moderate exercise on most days. The activity shouldn't be too easy or too hard. You should be able to talk comfortably while you are exercising. Having cancer is stressful and emotional. Research shows that talking to someone about your feelings or doing activities such as yoga or meditating to relieve stress and anxiety can help your fatigue. Eat healthy foods and lots of variety to have more energy. To stay hydrated, drink at least 6 to 8 glasses of water or other liquids every day. When you are fatigued, you may have less energy for daily activities. Use your energy wisely in order to be able to do the things that are most important to you. Listen to your body and rest when needed. It is common for people with cancer to have problems sleeping, but you can make small changes to get better rest. Wake up at the same time each day. During the daytime, rest in a room other than your bedroom. Limit alcohol and caffeine in the afternoon and evening. Turn off all screens, including computers, TVs, and iPads, at least 1 hour before going to bed. You don't have to cope with your fatigue alone. Allow family and friends to help you. There are many places to find support in your community and through your cancer care team. The Northeast Cancer Center offers a Fighting Cancer-Related Fatigue class led by the Supportive Care Program for cancer patients and caregivers. The class offers strategies for coping with fatigue and is available by teleconference. Cancer Care Ontario also has a patient symptom management guide called How to Manage Your Fatigue that can be used by patients and family. Hepatitis is an inflammation of the liver and is a less common side effect of immunotherapy. Symptoms of hepatitis may include yellowing of the skin or whites of the eyes, dark urine, pain on the right side of the stomach, nausea or vomiting, feeling less hungry, and bleeding or bruising more easily. Your cancer care team will monitor your liver regularly with a blood test. If you experience any of these symptoms, advise your cancer care team. Nephritis is an inflammation of the kidneys and is a less common side effect of immunotherapy. Symptoms of nephritis may include blood in the urine, a decrease in urine output, swelling in the ankles, and feeling less hungry. Your cancer care team will monitor your kidney function regularly with a blood test. If you experience any of these symptoms, advise your cancer care team. Pneumonitis is an inflammation of the lungs and is a less common side effect of immunotherapy. Symptoms of pneumonitis may include trouble breathing or shortness of breath, cough with or without mucus, fever, and pain in the chest. If you experience any of these symptoms, advise your cancer care team. Uveitis is an inflammation of the eye and is an uncommon side effect of immunotherapy. Symptoms of uveitis may include changes in eyesight, blurred vision, pain, redness, and sensitivity to light. If you experience any of these symptoms, advise your cancer care team. Fever is a temperature of 38.3 degrees Celsius or 100.9 degrees Fahrenheit or higher at any time, or a temperature of 38 degrees Celsius or 100.4 degrees Fahrenheit or higher for at least 1 hour. Fever is an uncommon side effect of immunotherapy. Symptoms of fever may include flu-like symptoms such as body aches and feeling warm, chilled, or shaky. If you experience any of these symptoms, advise your cancer care team. It is important to know how to take your temperature properly so you get accurate results. Oral thermometers are recommended to use. Do not eat, drink, smoke, or put anything hot or cold in your mouth 20 minutes before you take your temperature. Turn your thermometer on by pushing the on button. Place the thermometer under your tongue into a side pocket. Close your mouth. Wait for the beep to indicate your temperature has been read. Read and record your temperature. Some other side effects of immunotherapy that are rare but may affect blood sugar levels, muscles, or nerves. Symptoms may include hunger or thirst, increased urination, weight loss, muscle or joint pain or weakness, numbness or tingling in the hands or feet, confusion or memory problems. If you experience any of these symptoms, advise your cancer care team. The management of side effects from immunotherapy treatment is critical. If you experience any of the symptoms mentioned, it is very important to advise your cancer care team. Delaying contacting your cancer care team can result in serious side effects and may mean having to stop your treatment. Do not try to treat any of these symptoms with other medicines on your own. Once you notify your medical oncologist regarding side effects, they may order other medicine to prevent complications and reduce your symptoms, withhold the next dose of your treatment, or stop your treatment. It is important to understand that symptoms may occur weeks to months after treatment, and these still need to be reported to your cancer care team. It is important to understand tumor response to immunotherapy. Remember that immunotherapy drugs can cause organ inflammation or itis. This inflammation causes swelling as the T cells attack the tumor site, and the tumor may appear larger on the first scans for a period of time before tumor shrinkage is seen. This is called pseudoprogression and often happens before a good and prolonged response to treatment. Patients on immunotherapy treatment will be given a wallet card and, for certain drugs, an alert bracelet. It is very important to carry this drug wallet card with you at all times and show it to any healthcare provider, such as emergency department staff or dental staff, involved in your care, as it contains important safety information for them to be aware of. You will receive a treatment schedule from the booking clerks in the chemotherapy department. Immunotherapy is given by intravenous infusion over 30 to 60 minutes every 2 or 3 weeks, depending on the drug you are ordered. Your cancer care team will assess your response to treatment every few months. Blood tests will be done prior to each treatment to check your liver, kidney, and thyroid function. Blood tests are done before noon the day before treatment or the day of treatment on Mondays or after holidays. Blood test results may affect treatment. We ask that you register at the chemo registration desk 3 hours before your appointment if blood work is required on the same day of treatment, or 15 minutes before your appointment if blood work is not required the same day as treatment. Immunotherapy may cause fertility changes in both men and women. As a result of this, pregnancy and breastfeeding should be avoided while on this treatment. It is recommended to use birth control during treatment and after completion of therapy for at least 4 to 6 months after your last treatment if you or your partner are able to become pregnant. If you plan to have children in the future, talk to your cancer care team before starting treatment. There are no special precautions for safe handling of your body fluids while you are on immunotherapy. However, if you are treated with both immunotherapy and chemotherapy, then it is recommended to follow the safe handling precautions for chemotherapy. Here are some tips to remember for the day of treatment. Length of treatment varies depending on what drug you are ordered. You will want to wear comfortable clothes and dress in layers with short sleeves for easy intravenous access. Patients and visitors are asked not to wear perfume, as some patients may be allergic or sensitive to smells. It is not a problem to eat before and after your treatment. Patients are allowed to eat in the chemotherapy room while they are receiving treatment. However, visitors are not permitted. Feel free to bring your own food with you or have your visitor pick food up for you. It is fine to take your regular medications prior to coming for your treatment. Bring all of your medications with you, including the ones prescribed by your oncologist. It is important to bring any pain medication in case you need it during your treatment. Only one visitor or support person is allowed in the treatment room with you at a time. Children under 12 are not permitted in the treatment room. Some important points to remember. Bring your completed record of immunotherapy side effects with you to each treatment visit. The nurse will review this record to see if there are any side effects that need to be further assessed. Bring your appointment schedule with you to each treatment visit so the booking clerk or nurse can verify you have all your required appointments. Carry your cancer treatment record with you at all times so the nurse can update it after each treatment. Complete Your Symptoms Matter report upon arrival for your chemotherapy appointment so the nurse can review your assessment of your symptoms. Arrive on time for your treatment, as arriving late may affect other patients. It is very important to inform your cancer care team if any other physician has ordered you to take steroid medications such as dexamethasone or prednisone. Call your cancer care team for symptoms such as diarrhea, 3 or more bowel movements than normal, blood in the stool, rash, shortness of breath, cough, fever of 38.3 degrees Celsius or higher at any time, or 38 degrees Celsius or higher for at least 1 hour. Remember, if you have a fever, go to the emergency room first and notify your cancer care team afterwards. Phone messages are taken by a telephone clerk. A nurse will call you back. However, it is important to know that calls are returned based on the urgency of the symptoms. The Cancer Center is open Monday to Friday from 8:30 to 4:30. The Cancer Center is not open on weekends or statutory holidays. Telephone calls are answered from 8:30 to 4 p.m. If you have symptoms and we will be closed for at least 24 hours, please seek emergency room care. The Cancer Center phone number is 705-522-6237. Dial extension 2900 to leave a message with the telephone triage clerk. The toll-free number is 1-877-228-1822. Dial extension 2900 to leave a message with the telephone triage clerk. If you have any questions that were not answered, contact your cancer care team.